Yeah. Okay, so we've started recording. Thank you everyone for joining us. Oh, there's Chad. I'll admit him. This is Willamette Week's endorsement interview for ballot measure 109. Sherry and Tom, we can let you start, or anyone else on the call start with about 2 minutes of sort of a background opening statement on this measure.
I just would like to say that I know it looks like Sherry, but it's pronounced Cherie.
Sorry, Cherie.
Thank you.
Yeah, and we'll just shift it over to Dr. Gideon's first off, but we want to thank you for the opportunity to seek your endorsement for Measure 109.
Yeah.
I'm Tom Eckert.
And I'm Cherie.
And we're the chief petitioners of the measure. So we'll be hearing from Dr. Gideon's.
Dr. Gideon's. We'll be hearing from Chad Kuske and Mara McGraw, who's here. And that's it, right?
Yeah, let's just shift it over to Dr. Gideon's to get us started. Dr. Gideon's is an OHSU doctor who has worked with the terminally ill patients.
Yeah, I'm a OHSU Associate Professor of Family Medicine and work as a hospice medical director in Portland and Salem. And I simply want to say that for the last couple of years, I've been following this research closely, and I'm very excited about the measure bringing what really can be a breakthrough therapy for end-of-life care. The studies in advanced cancer are particularly strong. And we know that much of what we have currently, while it can be helpful, is often not as helpful as we'd like, as Oregon's mental health statistics show. With that, I'd like to turn it over to Mara to share that perspective.
You're on mute, Mara.
Trying to figure that out. You're still on mute.
Had to go back and forth a little bit there. Okay. I'll bring up my little talking points. Hi, I'm Mara McGraw. Let's see. In 2017, I was diagnosed with a rare cancer called neuroendocrine, which is unfortunately terminal. During the last 3 years, I've undergone a number of treatments, including medications, multiple surgeries, chemotherapy, and radiation. Some have helped alleviate the pain and immediate danger, but there is no cure. I had a lot of anxiety when I thought about treatment options and end-of-life planning, which took over my ability to make decisions. This summer, I went through 4 months of chemotherapy, but the cancer continues to metastasize. After chemo failed, I went to a pretty dark place, feeling hopeless about treatment and the future. Alongside meditation, I tried Prozac for the anxiety, but I developed a dangerous condition called serotonin uptake syndrome, and I had to stop. The only option left for me was opiates, which just sedated me without getting to the root cause of my anxiety. I heard about psilocybin therapy happening in Canada, and I decided to give it a try. I was fortunate to find a trained and experienced facilitator in the United States who was willing to help me. We met to prepare beforehand and to integrate afterwards. It was a safe and nurturing experience for me. I felt an immediate release from fear. An MRI just this month revealed that I have 20 new tumors in my brain. Time is running out for me. Before psilocybin therapy, I would have dropped into deep despair. I still feel grief and there's uncertainty about my prognosis, but I feel like I'm able to work through these things in a way that's less cluttered. I have less anxiety because I was able to get to the root cause of my fear in a way that talk therapy didn't address. I worked with a trained professional who knew how to administer psilocybin with the correct dosage, and the entire experience was very gentle. One of the effects of the therapy session is that my body remembered how to relax, which also helped lift the anxiety. The psilocybin therapy session helped me integrate my beliefs about death and dying and to approach end of life with grace. It was an uplifting and peaceful experience. I share my story because I'm not alone. We all know someone who's experiencing anxiety, depression, addiction, or who may be grappling with a terminal diagnosis. I'm profoundly grateful that I had the opportunity to participate in psilocybin therapy. Thank you.
Mara.
Great, thank you for sharing that. I want to start by talking about the efficacy and safety of psilocybin. So the measure text says that psilocybin has, quote, shown efficacy, tolerability, and safety in the treatment of a variety of mental health conditions, including but not limited to addiction, depression, anxiety disorders, and end-of-life psychological distress. I'm wondering, can you give a quick overview of the kind of clinical trials that have been done for psilocybin? And I know that the opposition pointed out that it hasn't gone through phase 3 of clinical trials, so I'm wondering if you could also address that aspect.
Dr. Gideons, do you want to take that one?
Sure. So the studies have occurred for over more than 40 years, but there's very active work in the last 4 or 5 years, particularly out of Johns Hopkins, NYU, and Yale, as well as in addition to European centers, particularly in Switzerland. Hundreds and hundreds of patients, totaling more than a couple of thousand, have been in these trials. They're structured much like the measure describes: pre-sessions, 1 to 3 sessions, integration sessions thereafter. And the safety profile, it skipped right through phase 1 because the safety profile of this compound is really well known, both because of the 40 years of study I've mentioned, as well as the degree to which there's recreational exposure. We're quite confident we know what the risks are for the rare but real physical possibilities that are easily screened for: serotonin syndrome, for example, or blood pressure rise, or acute anxiety during the session itself. The results are consistently really remarkable. When we look at standard therapeutics and pharmacology techniques, you see 30% responders, 30% reduction in symptom scores from standard daily pharmaceuticals, with very significant side effect profiles, much greater than we see from 1 or 3 administrations of psilocybin. Phase 3 trials, it's true, have not been fully undergone, but part of the problem is that as a non-pharma backed, non-daily medication, as a compound that we know about, it's not receiving that kind of funding, that kind of investment funding that you see from big pharma. So that's, in brief, what kind of really remarkable results we've seen in broad enough trials that I feel comfortable Oregon can safely move ahead and break ground here.
Okay, so the claims of that it can treat addiction, depression, anxiety disorders, that came from a result of phase 2 trials?
Yes.
Okay, gotcha. And also, I know that the FDA has granted psilocybin as a breakthrough therapy designation, but that only applied to major depressive disorder. Can you help explain why there's a discrepancy there, why the FDA is designating this for major depressive disorder, yet you're making the claim for a few other kinds of disorders?
Sure. I don't think it's unusual for the FDA to take a compound and essentially fast track it because, again, as I've said, results across studies and in major depression, treatment-resistant major depression, have been so remarkable, and the safety data and the ability to get through phase 1 has been so easily passed that then they give that designation to advanced studies in one area before the others. Simply, it's administratively simpler, and I think they probably chose the depressive disorder because it's such a high burden of illness. But it's not unusual to see breakthrough therapy designation for one indication while there may yet be others.
I'd like to make a broader point as well, and that is that psilocybin is not some new pharma drug cooked up in a lab with unknown side effects. This is a natural compound. It's been around forever. It's been used by native peoples in ceremonial context for centuries, if not millennia. So we're looking at this through a therapeutic lens rather than a strict pharma-driven lens, because that's what fits. And I think when we listen to kind of OPA's talking points, they're really trying to push this into a model that isn't appropriate for psilocybin-assisted therapy. This is therapy, and we treat it that way. And it was wrongfully banned back in 1970 by Richard Nixon for purely political reasons. So we want to undo that and correct the record. There were, as Nick mentioned, there were lots of studies way back in the 50s and 60s that all showed, before it was banned, that this was a safe therapeutic agent. And of course, in the last 20 years, the research has only confirmed what we already know. And that's that psilocybin therapy is super effective and has an excellent safety record.
Sorry, this is probably a dumb question, but how would this be synthesized? Is it a simple compound for chemists or pharmaceutical pharmacists to develop and to standardize, so that if this measure were to pass, that patients would know they were getting a standard, consistent level of strength?
Yeah, it's written into the initiative that there will be health and safety standards around the product itself. Producers of the product will be licensed to do so, and we'll go through an application process that will be created by an advisory board of experts. So we're sure that we're going to get excellent products.
And I'm sorry to be stupid. The product would still be grown organically like mushrooms. It wouldn't be made in a vat.
It's not. It could go. So the production can be organic material or it can be synthetic. We don't impose any restrictions on that. The advisory board will work out the details of ensuring safety and health standards.
However, that being said, it is important to note that one of the charges of the Oregon Health Authority and the advisory board is to make sure that there is quality control for the product itself. So there will be a standardized quality control that all producers will have to adhere to.
Exactly.
Okay.
Let's go ahead.
Oh, sorry, what was that?
No, I'm sorry to interrupt. Go ahead, please.
Oh yeah, no problem. And then in terms of the actual facilities and what they'd be like, I know there's a 2-year implementation window, but I'm still curious about, like, is it that anybody can walk in, or do you need a referral from another medical professional, or what are you thinking in terms of how to actually access this treatment?
Sure. So there's a screening process, and that, again, this advisory board of experts will be made up of medical experts as well as therapeutic mental health professionals. Will kind of detail what that screening process will be about. And it will be detailed. We've already set up a prototype board who's discussing this in detail. So we wouldn't want to, include all those details in the legislation itself, because we don't want to tie the hands of the OHA to make specific rules and regulations that are appropriate. But I think the board will define screening processes, and we're 100% confident that those processes will be very appropriate.
And I think to go even a little bit further, if somebody were to walk into a service center and say, hey, I want to do this, there will be a period of therapeutic session. So if you walk in and you say, I want this, you're going to still have to go through the process.
You'll be scheduled for an intake. So there's a sequence of sessions involved. This is not a walk-in type situation.
Yeah.
Okay. And in terms of the service providers, it was unclear to me in the text, would they be like licensed medical professionals, or what are the qualifications to be one of the people administering this drug?
Sure. Well, you certainly can be a medical professional or a mental health professional. We invite those applications, and I'm sure the bulk of the program will be built around mental health professionals. So it's also a little bit open because, again, we didn't want to tie the hands of the OHA. This is a therapeutic model. We want to give opportunity for people with the heart and discipline to finish an intensive training program and pass an exam to get involved in some way. Now, the advisory board will decide where it's important to have medical oversight, and we imagine in the assessment piece, for example, and that dialogue will happen. What we didn't want to do, however, is kind of lock this up in hospitals only exclusively and with psychiatrists exclusively, because again, this is not a pharma modality. This is a therapy modality. And I don't know if Chad's on the line, but I think maybe we could hear a little bit from Chad in terms of, just what is the difference between a psilocybin therapy modality and kind of a more medicalized pharma approach, because I think it's a really important distinction. Or if Chad's not on the line, maybe Mark.
Yeah, I'm here.
Oh, you are there. Good.
Hi, everyone. Chad Kuske. I was a Navy SEAL for 18 and a half years, and I was medically retired due to PTSD as sort of the umbrella of everything that entails, including, substance use and alcohol use and all the ways I was trying to self-medicate for those symptoms. you know, after 12 combat deployments, and just, I was angry, unhappy, depressed, anxious, and I wasn't even capable of recognizing all these things because, you know, some of the training that we go through kind of teaches us to just stuff all that down. And, you know, through the years of suffering, I was, you know, I had all the opportunity for talk therapy, pharmaceutical treatments on antidepressants, and all kinds of other things, trying to regulate sleep, all these different things. You know, people presented me with other options such as meditation or mindfulness. And I wasn't even capable of acknowledging, number one, that there was anything wrong with me, and number two, that any of these options might actually help me out. And then about 2.5 years after being retired, I was fortunate to get linked up with a group that was offering psilocybin therapy. And it was, you know, my first experience with that group. It was supervised by a medical doctor, and it's just an exceptionally well administered, comprehensive program. And in the course of a weekend, it absolutely transformed my life and helped me to see that all my efforts had been going in that direction. And, you know, despite what I thought were good intentions, I was going the wrong way, and that I needed to be going this direction. And more than anything, psilocybin therapy gave me the awareness of number one, what I was experiencing, what I was struggling with. And it also showed me sort of the path and gave me the tools that I needed to start going in the other direction. And that awareness creates space between me and all of these, you know, emotions and things that were tied to the ongoing suffering I was dealing with. And it's since allowed me to, you know, continue making progress. I still, you know, I'm still dealing with, you know, the symptoms that developed after 39 years of living a certain way, especially just all the trauma and everything that goes along with, you know, going to war for 15 years. But I'm aware of all these things now, which allows me to actually take positive steps to start, you know, moving my life in the other direction. And I haven't looked back since. I've been able to share these experiences since. I'm actually, I've been supporting a program that helps veterans like myself have these experiences in a safe, secure setting, which is so incredibly important. The integration coaching, the pre-screening where you talk to a coach or a therapist before you go into the process is absolutely critical, so that you can understand what to expect and help to formulate your own intentions about what you want to get out of the medicine. You know, I've also done psilocybin therapy in more traditional sort of ceremonial, sacred circle types of groups where there's no medical oversight other than, you know, anyone who's a reputable medicine worker understands these, you know, the very limited range, you know, there is a few contraindications, and they all understand that, and it's part of their screening process. And so I've benefited from both styles, the very clinical sort of manner, and even those clinical ones, they when they're done properly, for, you know, in my opinion, they still integrate a lot of that sacred ceremonial aspect of it. It's a very big part of how the medicine works. But since undergoing treatment myself, you know, I have not looked back a single day. It's been the best year and some change of my life. You know, an ongoing process, but I've also seen the same effects in, I've lost count, well over 100 other veterans, I think, that I've seen have very similar effects, and people from all different walks of life. So the main reason I'm, you know, sharing my story and trying to help this measure pass is because I know from personal experience how much more effective psilocybin therapy is than anything else that was made available to me. especially when done properly, and then with the integration and integrating these new practices. And I want to see it available to everyone, not just veterans from special operations backgrounds, but anyone who's suffering. The last thing I'll add is that, you know, I suffered from alcohol and substance abuse for probably alcohol for my whole entire adult life, drugs for probably a decade. And since undergoing psilocybin treatment, any desire to return to that has been completely eliminated. You know, that's just my own personal experience, but I've seen the same thing happen in a great number of my friends and former teammates as well. So thank you all.
Hi, Ted. This is Rachel Monahan. I'm one of the reporters on staff, and I've read a little bit about psilocybin therapy, but I think it would be, and I know that it can be hard to put into words what you were talking about, but there was one moment where you were describing what your first weekend of treatment did for you, and you said you had been headed in one direction and you realized you needed to head in another. Can you try and talk about the specifics of that? What direction were you going in to try and heal yourself before psilocybin treatment, and what direction did you head?
Yes, thank you, Rachel. That's a great question. I think prior to the treatment, just, you know, I was completely self-involved. I was really incapable of making connections with other people, and I was not even really connected to my own body and mind. And so, you know, every effort I made was sort of in this bubble of just my own kind of defense mechanisms and stories that I'd been kind of creating to defend myself and protect myself for, you know, the first 39 years of my life. And psilocybin, it is very difficult to describe, but, you know, so many of these things that I'd been thinking about and talking to therapists about for, you know, a decade or longer, and just could never make any progress. You know, with psilocybin, it just everything just becomes immediately crystal clear. The truth is just unfiltered, unbiased, and presented. Presented's not even the right word, just sort of known. And after you see that, it's like you don't have to think anymore. It just becomes completely clear what was going on, what wasn't working, what was working, what you need to be doing, the things that are actually important. And then when you take those lessons and are able to integrate them into your life through coaching or therapy after the session, and you start making these changes, and then I was able to carry that awareness with me. So now when things that would have triggered me before come up, I can look at them, I can watch it happening, and that I have the time to take a different approach, to use these tools that everyone told me about beforehand, but I was completely incapable of accepting or implementing, and now use those tools to respond rather than react. And that allows me to make the choices that, basically, in a nutshell, through psilocybin therapy, I realized that instead of always looking outwards and trying to blame things or find what caused these problems, or, you know, why can't I find a solution, it showed me that I had everything I needed inside all along. And then through the awareness of that, I can respond to life, as opposed to just constantly being in a state of reaction.
Can I just add in there?
Describe a little bit more about what goes on in the brain with that in a more medical, physiological level, if you want to ask, as time allows.
Wonder if I could also add just super quickly that, you know, kind of the revolutionary aspect of this and what makes it therapy is that this is a therapeutic experience. What you're hearing from Chad is he was able to come to his own conclusions, see things from a new perspective, basically help heal himself. And that's different than a pharma drug that is tamping down symptoms and kind of divorcing you from being connected to your experience and your thought processes. So that's why this is different, and I think that's why it works so well. And we hear that with Chad. Thank you.
And about how many treatments would you say are necessary to achieve these results? I'm sure there's a spectrum for every person, or is it an ongoing therapy for the rest of your life, or do you 5 to 6 times and you're good to go, or what does it usually look like?
Typically between 1 and 3, that's what the research shows. So yeah, this is another way that it's different than conventional approaches and makes it more efficient and effective. It's a big experience that when facilitated in a careful way, brings people to new understandings, new epiphanies, emotional breakthroughs, and importantly, integration afterwards helps you bring these experiences into a mental health plan. So you can have more integration sessions after the profound experience, but you don't need to keep revisiting that experience necessarily. And by the way, psilocybin is not addictive, it's not toxic, it's not the kind of thing that draws people back over and over again. It really takes a while to kind of unwind the impact of the experience through therapeutic work.
And I think that Mara and Chad are really good examples of what just one or a few psilocybin therapy sessions can achieve, the actual administration of the medicine itself. And then we hear Chad carrying on with the wonderful part of what integration can actually achieve. And so both Mara and Chad are really strong, outspoken individuals about how it's helped them.
Yeah. And integration sessions, just to be clear, are those sessions that come afterwards that are more conventional, talk-oriented, talking through the impact, as opposed to the psilocybin session, which is really an internal experience.
Okay. And in terms of the money aspect of this, I know that the text for the measure says that there'll be a 15% tax on the retail of psilocybin. Is that correct?
Yeah, just the product itself, not the services. So it doesn't tax the therapy, it's just the actual product, which is actually pretty minimal, but that tax will help fund the program and make it revenue neutral.
Okay. So about how much money is that expected to generate annually?
Well, it's going to just fulfill the need of the program. So in other words, those costs are helping offset application fees and whatnot, just to make the program revenue neutral.
Okay. And I read that the program is supposed to cost $3.1 million annually. So you're thinking the tax will raise that much?
It could. So, once the program's up and running, it will be revenue neutral. There's a little bit of cost in that 2-year development period to get it up and running. It's possible, but that tax might offset kind of retroactively those costs.
Okay. And this is a point that the Oregon Psychiatric Physicians Association brought up. Do you think that right now, given the fact that we're in the pandemic and OHA's hands are full with managing that, is now the right time to implement this kind of, revolutionary? I mean, it's a big thing to implement. So is now the right time to do that when our health department is already overwhelmed with managing a pandemic?
Well, I think we all could speak to that. We think it's 100% the right time. The OHA is supposed to create programs that benefit the health of Oregon, and we are in a mental health crisis right now. We were in, before COVID hit, we were in a mental health crisis. We have the worst rates of mental illness in the entire country, and I would argue that the country has a mental health crisis. So this is absolutely what we should be doing.
Yeah, I think that the charge of the OHA, as Tom said, is to look out and see what we can do for Oregon citizens to help release and remove some of the mental health crises that people are experiencing. And this can actually do that in such a way that our state doesn't lose billions of dollars every year to lost work and to disability and to medical care, but instead people can potentially be healed and that cost will go down. So I think this is the absolute right time for Oregon.
You could make the case that it's 50 years overdue. It was wrongly prohibited in the beginning. Psilocybin therapy should always have been in the mix, helping people. People are suffering who could otherwise benefit from this effective treatment with an excellent safety record. So, let's get to it. That's our thought about it.
I'll add that, the process of bringing together experts, of which many will be quite willing, whether that's national experts or those of us locally who are studying it, the psychiatrists I know in favor of it, et cetera, bringing together a panel, having the staff time to have them come together. What you've heard from Mara and Chad are very congruent with the study protocols, which are well published. With the SAFTA data. So while I agree it's going to take some effort, I don't think it's an overwhelming effort at all compared to many of the regulations and rules that OHSA has to promulgate for much larger sections of the healthcare sector.
Yeah, and we're not reinventing the wheel. We're going to enter into this, into the advisory board, into that 2-year period with great information around how to set up training programs and protocols.
So Tom, just to be very clear, when you say you're not reinventing the wheel, wouldn't it be the case that this is we would be the first state in the country to take this step?
We would, and that's because, Oregonians are trailblazers when it comes to thoughtful policy.
Yeah.
That said, psilocybin therapy is offered at top-notch institutes across the world right now. Johns Hopkins, NYU, UCLA, Imperial College of London, Wisconsin, Zurich, Harvard, I could go on. So, I mean, this therapy is being offered in those settings and has been for quite a long time. But what we need is to integrate it into society because people need help.
So within the context of those institutions, a template has been established. And so what we've done is we've looked at the template that these institutions have used, and we've modeled this measure after the rigorous scientific research and the clinical studies.
Can I just ask one further question? Obviously, your opponents didn't show up today for whatever reason. The most, I guess, serious critique they've offered is this will allow prescribing of a controlled substance with effects on the body and the brain to a practitioner with no medical training. Now, obviously, they're trying to protect their turf and they don't want competition, or maybe they don't. Whatever their motivation is, that's a serious concern. Could you please respond to it?
Yeah, I think, the overarching argument is that this is a therapeutic modality, not a new pharma drug with unknown side effects that just got cooked up in a lab. So it's a matter of the lens we're looking at it through. And I think our lens is appropriate, that this is a therapeutic approach. And it's an extremely careful therapeutic approach. I think we've spelled it out pretty well. The 2-year development will address any sticky issues that come up. We certainly will have medical personnel on the board, on the advisory board, to go over all of these questions. And there's just no way we're going to come out of that without really clear guidelines that address any of these issues that come up.
Thank you.
It's not widespread. The patient doesn't self-administer. It's not really prescribed. It's administered.
And that's a very important point.
And just out of curiosity, how long would a session last? I imagine the high lasts for several, or whatever the phrase is for it, lasts for several hours. So how long would you be in this facility for?
I think the experience can last anywhere from 5 to 8 hours, and the individual will be in the facility for as long as it takes until they're able to be cognitive and lucid and ready to be picked up and driven home.
Yeah, there's statutes around being super careful about nobody's driving home while altered. And all of that important stuff. So yeah, they'll stick around for a little longer than they probably actually need to. The experience itself is usually 4 to 6 hours.
Okay, Nigel and Rachel, I think I'm good on questions. I don't know if either of you have any more.
No, I'm fine. Thanks. Thank you all.
Cool. Well, I think, this was really helpful, and our endorsement issue is going to be out on Wednesday. So.
Oh, wow. Great.
Yeah, really
awesome.
Let's get to it.
2 days out. Yeah.
Well, thank you guys so much. I appreciate all the really good questions, and we appreciate the opportunity to speak to them.
We do. We really appreciate your weekly paper anyway. We appreciate you in many ways. So thank you for this opportunity.
Yep.
Yeah, thanks.
Take care.
Thank you.
Rachel, are you still on the line?
Yes, I am.
Oh, let me stop recording. I I think it looks like Nigel left.